Okay, let's talk about a medication that is just everywhere right now. It's all over the headlines, it's all over social media, it goes by a few different names, but the science behind them, that's what's really changing the game. So let's get into it.
Yeah, you definitely know the names. You've seen them, you've heard them. They're impossible to miss, right? They've basically become household names in what feels like the blink of an eye.
I'm talking about Ozempic, Wegovy, and Rybelsus. Yep, those three. They have totally shifted the way we talk about everything from diabetes to weight management.
But what are they really? Like, when you get past the hype and the brand names, what is the actual drug doing inside the body? What's the science here? Well, that's exactly what we're going to unpack today. So here's the plan. We'll start with what semaglutide even is. Then we'll get into the 3 official uses, how you take it, why it's gotten so popular, and of course, we have to talk about the risks and the things you need to watch out for. All right, first things first, what is semaglutide? Let's get right to the heart of what we're talking about. So, semaglutide is what's called a GLP-1 receptor agonist. I know, that is a total mouthful, right? But here's what it boils down to. It basically mimics a hormone your body already makes naturally. And this has this really cool 3-part effect. First, it helps get your blood sugar under control. Second, it dials down your appetite. And third, it actually slows down how fast your stomach empties. The result, you feel fuller for longer. Okay, so knowing that's how it works, it makes total sense that it's officially approved for some very specific things. So let's talk about who this drug is actually designed for. So use number 1 is for type 2 diabetes. This is where it really shines at improving blood sugar control. And a huge plus is that it does this without a big risk of causing hypoglycemia, that dangerous drop in blood sugar. In fact, it's so effective that major guidelines give it a big thumbs up, especially for patients who also have heart issues or for whom losing weight is a major goal. All right, use number 2 is the one you've probably heard the most about, weight management. This is approved for adults who have a BMI of 30 or more, which is clinically defined as obesity, or for folks with a BMI of 27 or higher who also have another weight-related issue like high blood pressure or diabetes. And this leads us to the third and honestly really critical use, reducing cardiovascular risk. So for people who have both type 2 diabetes and existing heart disease, semaglutide has been proven to lower the risk of major events. We're talking things like heart attacks and strokes. So it's not just about blood sugar or weight, it's literally about protecting your heart. Okay, so we know what it is and who it's for. Let's get down to the nitty-gritty. How do you actually take it? It really comes in 2 main forms. The one you hear about most is the injection. It's what's called a subcutaneous injection, which just means it's a shot you give yourself once a week just under the skin. That's Ozempic and Wegovy. But there's also a pill version called Rybelsus that you take once a day. Now, the way the dose is handled is super important, especially with Wegovy for weight loss. You don't just jump to the highest dose. It's a very deliberate, slow ramp up over 5 months. You start at a tiny dose and increase it each month. This whole start low, go slow idea is absolutely key to letting your body get used to it and keeping those side effects at bay. And if you're taking the pill, Rybelsus, listen up, because the instructions are not a suggestion. They're really strict. You have to take it first thing in the morning on a totally empty stomach. And you can only have a tiny bit of water with it, like 4 ounces max. Then, and this is the important part, you have to wait a full 30 minutes before you eat anything, drink anything else, or take any of your other meds. You have to follow those rules for it to work properly. So that brings us to the million-dollar question. Why the heck is this so popular? Why is everyone talking about it? Well, the answer is in the results. The numbers are just really, really impressive. Let's start with diabetes. For those patients, it can bring down their HbA1c, which is kind of the gold standard for measuring long-term blood sugar, by about 1 to 1.5%. Now, that might not sound like a lot, but in the world of diabetes management, that is a huge deal. It's a really significant drop. And then there's this. This is the number that made all the headlines. In the big clinical trials for weight management, people taking the full dose of semaglutide lost, on average, up to 15% of their body weight. I mean, think about that, losing 15% of your body weight from medication. It was a game changer. We really hadn't seen anything like it before. But, and there's always a but, right? With results that powerful, we have to talk about the other side of the coin. No drug is perfect, and it's so important to be realistic about the potential risks.
Okay, so the most common side effects are pretty much all related to your gut. Nausea is the big one. It's definitely the most common complaint. Vomiting and diarrhea can also happen. And of course, reduced appetite is listed as a side effect, which for people trying to lose weight is kind of the whole point.
Now, moving past those more common issues, there are some more serious risks to be aware of. They are much less common, but you need to know about them. We're talking about things like pancreatitis, which is a painful inflammation of your pancreas, gallstones, and a potential, very rare, risk of a very specific kind of thyroid cancer.
And because of that thyroid cancer risk, there is a very, very clear warning, what's called a black box warning. This medication should absolutely not be taken by anyone who has a personal or family history of something called medullary thyroid carcinoma or another rare genetic syndrome known as MN2. It's a hard and fast rule.
So really, when we talk about safety, it all comes back to that one key piece of advice we mentioned earlier: start low and go slow. Seriously, that gradual dose increase isn't just a nice idea. It is the most important thing you can do to manage those stomach side effects and actually be able to stick with the medication.